Hi, Mrs. Jones. I'm Isabella. I'm going to be your nurse today. Can you go ahead and tell me your name and date of birth? At this time, I would check the wristband to identify the patient. All right, perfect. I was told that you were having a hard time urinating, so I got orders to do an in and out catheter as well as peri-care. Are you allergic to shellfish, beta iodine, or latex? No? Okay, perfect. At this time, I'm going to go ahead and provide privacy and raise up Mrs. Jones's bed. All right. I'm going to go ahead and remove Mrs. Jones's cloth. Bedding down first. Then this time I would wash and dry my hands and apply clean gloves. Okay, Ms. Jones, I'm going to go ahead and lift up your gown. All right, I'm going to go ahead and position Mrs. Jones into a Dorsey recumbent position. All right, Mrs. Jones, we're going to go ahead and perform peri-care. I'm going to go ahead and gather my washcloths real quick. All right, today I'm going to be having 4 washcloths. I'm going to go ahead and start by swiping the inner thighs, doing it down, up, down, and doing the thigh away from me first, and switching a piece of the cloth each time I swipe, and then discarding. I'm going to go ahead and grab the next one. And then I'm going to discard the third one, and then discard. All right, Mrs. Jones, I'm going to go ahead and turn you over. This time I'm going to wipe Miss Jones's buttocks. All right, Miss Jones, let me know if you feel any discomfort. And then discarding of that cloth, and then slowly bringing Miss Jones back down into a comfortable position. All right, at this time, I would remove my gloves and wash and dry my hands. At this time, I'm going to go ahead and get my supplies ready. All right, Mrs. Jones, I'm going to go ahead and put this down by your feet so it acts as a little trash bag for me as I'm inserting your catheter and doing peri-care, just to make it a little bit easier for me. And on this, I have a 1-inch margin. Okay, at this time, I'm going to go ahead and apply clean gloves. I'm going to go ahead and apply a protection sheet under Mrs. Jones' buttocks just to reduce infection. At this time, I'd go ahead and take off my gloves once again and wash and dry my hands. And at this time, I'm going to apply my sterile gloves. One-inch margin on these as well. We're going to discard this from the middle because that is what is sanitary. All right, Mrs. Jones, we are going to go ahead and start with pericare. I'm going to go ahead and organize my station first. For this procedure, we'd be using beta iodine, but because of it being a mannequin, we cannot use it. The same with lube. We're going to act as if I am using lube. I'm going to go ahead and apply this drape over Mrs. Jones just to provide a little bit more protection for infection. All right, Mrs. Jones, I'm going to go ahead and start with pericare. I'm using 2 cotton swabs today acting as iodine. The first one is the outside. And then I would discard and grab the second one and go straight down. And I would discard of this as well. All right, I'm gonna go ahead and put the lube into my little cup here. And I'm gonna go ahead and lube up my catheter. At this time, I would always be remaining this hand on. All right, Mrs. Jones, I'm gonna go ahead and apply it now. I am putting it in 2 to 3 inches until there's urine outtake, and then 1 to 2 more inches, waiting for all the urine to come out. And I would push down on her bladder just to help out a little bit if she's having a hard time. Right, perfect. I'm gonna go ahead and remove out the catheter very slowly. At this time, I would be assessing the color, odor, and the amount of outtake. All right, at this time, I'm gonna go ahead and clean up. And at this time, I'm going to go ahead and remove my surgical gloves. I would go ahead and wash and dry my hands now. And I'm going to reposition the patient. At this time, I would do another pericare. Right, at this time, I'm going to lower Mrs. Jones back down. And after this, I would go ahead and document my findings, such as the use, why we did a catheter today, the urine characteristics, such as the odor, the color, and the amount of output there was, as well as supplies used, the size of the catheter and what catheter was used, as well as the teachings that I did. And at this time, I'm going to give Mrs. Jones her call button, and I'll be back to check on you. Let me know if you need anything.